Joining me now, founder Bethel Safe Autism Foundation, Oluwatosin Akonde. She joins me in the studio. I also have Heavenly Dara Osadebe, advocate for children living with disabilities. She also joins me in the studio. Good to have you both for joining us.
Thank you for having us.
Especially you, Dara. I mean, very, very interesting to have a very young person, as an advocate for people with disabilities. And I want to start with you before we even get into the general conversation about autism. I mean, what prompted you to become an advocate for people with disabilities?
My mom, and I always watch Dr. Oluwatosin. She prompted me to become an advocate. She made me realize that autism isn't just someone being crazy. It's not a bad thing. It's just different, and different doesn't mean less. So that's what I've really come to understand, that people with autism aren't bad. They are different.
And I want to pick it from the point, because she made a very interesting point. It's about being different, because most people don't know what to do with people living with autism. It's not that they are bad persons; they just don't know how to handle it. And then I find that one of the guests who you had on your program also talked about humanizing stories that have to do with people with autism, living with autism. How far have we gone in terms of inclusion, including those with autism, whether it's in the education system or in the health system?
Oh, thank you very much for asking that question. So what I've found out in this part of the world is that they are not well accepted. They see children with the spectrum as a second-class citizens, and yes, the symptom is there, but they're not being accepted. There's awareness, but no one is helping them out. The government is not helping them out. Even the schools, there are no special school for children on that spectrum. So with Bethel Safe, what we decide to do is to go into the rural communities and then bring out those children, taking them to the hospital, doctors doing their own needful, and then we brought in therapists to help them, and then we do training as well for the parents so that they will know how to take care of their children.
I was just going to talk to you about the parents. I was going to ask you how difficult it is for them, especially when you're in, because most times people think of, you mentioned the spectrum, anything that has to do with maybe chromosomal or disorders, biological disorders, the first thing we think as a society is spiritual and not biological or health or medical. And so for parents like that, how do they deal with such challenges?
So with the parents and their caregivers, we had to educate them first, and then they had to accept the fact that they have children on the spectrum. We had to explain to them what the spectrum is all about, and then with all the stuff that they see, the symptoms they see with the children, we're able to explain that to them so they can have an idea and accept the fact that they have children living with the spectrum. So when we trained parents as well and their caregivers, and then we also train those children. So it's really difficult because most parents do not accept the fact that the children are on the spectrum. Most of them believe, oh, it's a taboo, it's a curse from somewhere. So we had to renew their mindset, and then for them to accept that the fact that the kids are on the spectrum. So we renewed their mind. We started training them. We had the psychologists come in to speak with them. We had the counselors come in to speak with them. So they actually accepted the fact that we have children on the spectrum. We even have some of the parents that are on the spectrum themselves, that they didn't know that they were on the spectrum. So it was kind of challenging, but we're able to break through the barriers because we had all the expertise on board. So that was how we're able to break through the barrier of the parents.
Interesting. Just hearing you say you can be on the spectrum and not even know that you're on the spectrum.
Yes.
Right, let me come to you, Heavenly. You get to interact with some of these children from time to time. What do you hear from them in terms of the challenges they face, in society?
Can you explain the question?
So I was asking, you talk to these children, right?
Yes.
So what do you hear from them when you talk to them? How do people accept them? How do people see them?
People don't really accept them like that.
What Dr. Tosin said, people think that it's a curse. They think it's taboo. They don't really accept it. So yesterday, one of them greeted my mom, and I started crying because they are so respectful because of what Bethel Safe has done for them. They've called in counselors. They've called in different people to come and help them. So I'm actually really happy for them. Not that happy, but I'm happy that they are doing better than they were before.
And what more do you think that we can do? I mean, just beyond, what she's already doing, maybe government, maybe society can do for them?
I think that the government should make more special needs schools. Because most of these people, they are in the village, they don't even know something is wrong with their child. So the government can try and make free schools for them to at least try and help them, calling counselors, calling therapists, anything that they need to help them with. Because we need more good people in this world. And it has to start with us kids.
Absolutely, and it's how you treat them, that they also project in society. I mean, she's making a really good point. How you treat them, they also project into society. And I wanted to ask if, based off what she said, it's just the special needs schools. Some of the autistic people I've met are really smart. They have the capacity to focus on one thing and really become good at it. And we've not been able to harness that as a society. They are so smart. And I wanted to ask you, what more can be done?
Okay, so let me try and explain those children that are special and they're doing something great. When you look at it, they have parents that have accepted the fact that we have children on the spectrum. Those parents and caregivers have gone above and beyond. That is why you're able to see those children doing really well. Now, parents need to come out. I was a teacher for 10 years back in the US, and I worked with children with special needs. We have to convince the parents. Okay, let me give you an example. I have parents come from this part of the world bringing their children to America, and then when we analyze and then tell them your child has this during the meeting, and then they will say, oh no, my child does not have this, but these are the symptoms.
Denial.
They are in denial. So when a parent is in denial, they're not going to accept the fact that their children are on the spectrum. And when you don't accept that your child is on the spectrum, you cannot take care of that child. That child will not go beyond what he or she knows. But when they accept, and then you know that your child likes swimming, that is where the child's brain is going. Why don't you develop that child into what he or she likes? And then we had one of my colleagues yesterday, she was on the panel as well, Mrs. Aziza. Her son is on the spectrum too. And then she accepted the fact, and then she's an advocate as well. The child is doing exceedingly well.
Yes. And we hope that that's something that parents begin to look at, acceptance from parents, and then for government, like she said, Heavenly said, provision of special needs, more schools, for special needs children. Thank you so much for your time, and thank you for what you're doing for these children. Dr. Oluwatosin Akonde, founder Bethel Safe Autism Foundation. And Heavenly, thank you for being an ambassador. I mean, you chose a very rare space to be in. Heavenly Deros Adebe, actor, advocate of children living with disabilities. Thank you.
Thank you very much.
All right.